me tell you how we safely manage multiple drips in the ICU. When people that don't work in the ICU come into the ICU and see all the different drips and pumps that we have running at the same time, they're like very overwhelmed and like, how are you guys doing that? And honestly, once you're used to it, it's kind of like just second nature. But I want to talk about some little tips and tricks for things so that way you're managing multiple drips safely. First things first, whenever you are managing multiple drips, you need to make sure you check compatibility on all the drips. There's a couple different compatibility websites out there. I'm sure your hospital has one that they use, but Micromedics, Lexicomp, I will type in every single medication that I am currently running, as well as like whatever medications I'm going to be running throughout my shift, like antibiotics, electrolytes, and I will have a whole printout of which things are compatible. Here's like a very small example of what it would look like if you were just comparing two different IV drips, but typically your pressors are compatible and most sedation meds are compatible. So typically I like to run my pressors all into one and my sedation meds all into one. And then I use my separate lines for like my IV fluids, my antibiotics, my electrolytes, things like that. Typically, when you're running this many drips, you probably have a central line or you probably need a central line if you do not have one already. Peripheral IVs are good, but they're just not as reliable if we are infusing multiple medications and drips. I like to use something called a TriFuse. We also call this a turkey leg at my hospital. But instead of wide-siding all of your medications in, like all your pressors, you just have one long chain. I like to use something like this. So you could run like your levo and vaso in one line, your phenylephrine into your other line, your epi into the next one. So that way they're all kind of infusing together versus being one long chain. This is a manifold. This is another kind of thing that nurses use if you're running multiple medications into the same line. The other thing we will do is we usually create 1 to 2, maybe 3 TKO lines. TKO means to keep open, and we will just use normal saline or LR and run it as a primary, maybe at like 2, 3, 4, 5 cc's an hour. And then we'll have our secondary line in order to run our antibiotics, electrolytes. Because these patients are so sick, they usually have a lot of electrolyte replacements and things like that. So it's nice to have a line that's already set up and ready to go for when you're infusing multiple things. The last thing I want to end on is make sure you label and have your lines organized. I know ICU nurses kind of get the rap of being type A, OCD, but it's for a good reason. When you have this many things running, make sure you're labeling everything appropriately so that way you can easily track it and trace it. And always program your pumps for less volume that is in the bag. So that way you have time to request a new one from pharmacy, grab it from the Pyxis, whatever it may be, so your drips never run dry. For things that are super important and critical, a lot of times we'll just keep an extra bag in the room with us. But those are my tips and tricks. Let me know if you have any questions.